In this video, the mechanism of termination of the acute inflammation is described. The references for this are following. Acute inflammatory response is associated with the release of various chemicals, compounds, cells, cytokines, recruitment of further cells that causes the damage to the tissue. So this process should be strictly under control. There is a stimulus, and when this stimulus declines, it should be completely stopped. For this, to keep under check in the check, the cytokines are released in rapid burst, and these cytokines are short-lived. They have got short half-life. Also, the neutrophils have got short tissue life. Within few hours, they vanish, and to control or to stop the inflammatory process, to terminate this inflammatory process, first of all, the arachidonic acid metabolite that previously during the phase in acute inflammation, during the phase of acute inflammation, they were producing pro-inflammatory cytokines. Now they switch towards the anti-inflammatory cytokines that are lipoxin. So lipoxin are now produced more to control the inflammation. Then there is secretion of anti-inflammatory cytokines when the stimulus is gone. So transforming growth factor beta and interleukin 10 are now secreted, that are from the alternate type of the macrophages, and TNF production is stopped to terminate the acute inflammatory response. So we can summarize the control mechanism for to terminate the acute inflammatory process are the short-lived mediators. We know that key player of the inflammation are pro-inflammatory cytokines that are liberated from the neutrophil, but they are released in burst and they have got short half-life, so they degrade quickly and neutrophil die by apoptosis within hours. So one mechanism, or first mechanism for the development, for the termination of the acute inflammation. Then lipid mediator also switch toward the lipoxin formation. So the arachidonic acid that was previously forming the pro-inflammatory leukotrienes now start forming lipoxin that is anti-inflammatory. Macrophages and T regulatory cells are also start releasing anti-inflammatory cytokines such as transforming growth factor beta and interleukin 10 that suppress the inflammation. Then there is neural regulation through the cholinergic vagal signaling. TNF production is decreased, and this decrease will dampen the inflammation. Thank you for watching this video. If you have any question, please write in the comment box.